The consumer protection group Privacy Rights Clearinghouse studied 43 popular free and purchased health and fitness apps from both a consumer and technical perspective. Their key findings: considerable privacy risks to users and significant disclosure issues. Here with more details is PRC Director Beth Givens. And Beth, welcome.
Thank you, Peggy.
Tell us about the sampling of the kinds of apps that your team looked at.
Yeah, this was a relatively narrow study looking at the health and fitness apps, and we chose the kinds of apps that people choose for themselves. The very popular apps available from the two stores, online stores. Weight loss, big area. Blood glucose monitoring for people monitoring for diabetes or pre-diabetes. Smoking cessation, pregnancy tracking. Let me think. That's a pretty good,
some pretty popular
sampling.
ones,
Yeah.
and some running ones, right? That track
Yes,
your miles and things like that.
exercise and fitness.
Right.
Yeah.
I noticed in the study that it didn't include an estimated 40,000 hospital or doctor-based applications. So how come?
There is a category of apps in which you have a relationship with a doctor or a healthcare system, and they're actually getting information from you. Those are more likely to be covered by HIPAA, the federal privacy law, and also California's privacy law. So we decided just to stick to the apps that people are choosing from the marketplace.
And I want to let folks know, no, we're intentionally not naming specific apps because your findings are about sort of this disturbing trend as opposed to specific apps being, good or bad. What made the health and fitness apps that you looked at in this study, those 43 kind of popular ones, what made them a privacy risk?
Most people consider, I think, their medical information, their health information to be very sensitive, probably the most sensitive type of personal information for most people. Probably the next second area would be financial. But I think most people consider that information about their health is highly sensitive. And so that's what we thought we should look at this particular area. We had a hunch that there might be some questionable practices going on, not necessarily maliciously, but perhaps just from the standpoint of not thinking about privacy.
Some of the big key ones were, do tell us about the big one about the third party.
Yes, well, a couple of big ones. A key finding is that very sensitive medical information, personal information, is sent across the network unencrypted. And then secondly, the
third party, right?
The huge number of third parties that are receiving information from these apps that it's not disclosed in a specific way in the privacy policy, and sometimes not disclosed at all. There are a number of third parties that do get this information, and you should assume that.
And we're talking third parties like advertisers, or are we talking third parties like health insurance agents?
Well, not health insurance. At least we couldn't see that. I mean, that's obviously a potential, but it's advertisers, advertising networks, and the analytics companies. Okay.
Did you find a difference between free apps or purchase apps as far as which ones tended to be a little looser with your privacy information?
Well, free apps, their business model is to make money, to get income from the selling of personal data so that the advertising networks can feed back to you highly targeted ads. So the business model of free apps, of course, contributes to more privacy risks. The paid apps, they just don't have the business model of needing to share your information to make money. So there are some privacy problems with the paid apps, but there's a little bit of a privacy advantage going with paid over free.
Okay, and let's go through. You have some tips to basically help protect yourself if you want to use these apps, which you're saying go ahead. So tell us a little bit about the top tips that you found.
Sure. First, do some research on the app. It may not be easy, but you can always take the name of the app, put it into your favorite search engine, and add the word complaint. Or take your favorite app and add the word review. And that way you can read both the reviews, probably delve into more information, and if there are complaints. And
we talked about the free versus the paid apps.
And assume that the apps will be distributed. And when you're actually using the app, especially first signing up, just watch yourself. What information are you being asked to put in? Is that information, do you have choices? So if you have a choice to minimize that personal information, for heaven's sakes, take advantage and don't give out more information than is needed.
So if possible, like you said, limit the information. And then finally, when you're done with an app.
Well, delete it. You don't need to be carrying this around on your smartphone. And if you can, go to the app developer or the app publisher and see if you can delete the profile on their end.
Okay, so some excellent tips. And I want to let folks know that they can see the entire report that you did, the entire study, clearinghouse study on our website, kpbs.org. So Beth Givens, thanks so much.
Thank you.